Hello, my name is Dr. Asley. I'm a board-certified fellowship-trained spine surgeon, and I'm the medical director here in Spine Treatment Center. In this segment, I would like to talk to you about a condition called spondylolisthesis. What it means basically a slipped disc, a slippage of one vertebrae over another. Now, for that, let's review the normal anatomy one time. As you can see, the vertebrae are stacked on top of each other, and therefore they form the spinal canal, which all the nerves kind of go through. In front, the vertebrae connect to each other through the discs, which we've discussed it in a previous section. And in the back, they connect to each other through these joints, gliding joints, we call them facet joints. Every vertebrae connects to the vertebrae above and below with these processes and form these facet joints above and below. Now, this bone bridge between the articular process above and below, they call it pars interarticularis, basically the section between the two joints. That's the normal anatomy. Now, sometimes some people, because of injury, they have a fracture right at this level. And when that happens, the way that the discs connect to each other is only through the disc. Therefore, there's too much pressure on this disc. Therefore, the vertebrae can slip over the next vertebrae. Now, as you can see in this CT scan, this is an example of a spondylolisthesis. As you can see right here in this view, let's focus on this. This is what we call the sagittal view. So it's like almost slicing the patient in half. You're looking from side on. You can see these are the bones that are stacked up on top of each other, and these lucencies between there are cushions between the bones. We call them discs, the cartilage. You can see the back of the vertebrae should align pretty well. However, you can see that there's a slippage between this bone and this bone. This patient also suffering from a damaged disc at the level of L5S1. However, at the level of L45, there's definitely a slipped disc. Now, if you go through the slices toward the corner, which in this patient, it goes toward the left side, you can see in this image the pathology right here. Actually, in this image, you can see it a lot better. Right there. That's the fracture in pars interarticularis. But in this one, you can see the anatomy a little bit better. You can see in these vertebrae how it should be. One piece, the articular above, articular surface below, and there's a good solid bony bridge. In this vertebrae, articular surface above and below, and there's a solid bony bridge. In this vertebrae, you can see that there's a fracture right here. So the only way that this vertebrae connects to this vertebrae is through the disc only. And through the time, that disc, because it's bearing too much pressure, can deteriorate, and you can have a slippage, as you can see right here. And that's spondylolisthesis. Now, spondylolisthesis can happen without a fracture. It doesn't have to have a spondylolysis. Spondylolysis is the fracture between the pars interarticularis. But you don't have to have this fracture for the slippage to happen. Sometimes just the disc goes bad and then the vertebrae slips. And that can happen. And that is what we call instability in the spine. If that happens, then of course, not everybody who has this condition is symptomatic, has problems. I have seen people who were 80 years of age. They came to see me for an unrelated problem, and I saw it, and they have a slipped disc and spondylolysis, and they don't have back pain. And they went through all their lives not having problem. Or you can have problem at early age, like 18 or 19. People who have this fracture with a slipped disc and being miserable at the age of 18 or 19, or any time throughout the year. It could be 45, 46, 71. It can become problematic. And that can happen. If that does happen, of course, we'll try whatever we can to avoid surgery. The treatments would be epidural injections, physical therapy, traction decompressive treatments. And then if we try everything and the patient doesn't get better, then we have to intervene surgically. And the surgery is in the form of a fusion, because the slippage can get further and further and there's instability. Then you go in and do an anterior and posterior fusion and stabilize this area. And these surgeries are actually quite successful. They're about chance of success is almost like 90%. So they're pretty good in terms of patient outcome and patient being happy with their procedure. And that's the only way to treat it if the non-operative care doesn't help the patient. I hope you understood this section. It is very confusing. There are 3 words that comes up, and you need to know the difference. One is spondylolisthesis, which is basically the fracture. Spondylolisthesis, which is the slippage. And you have another word called spondylosis. Spondylosis just refers to generalized arthritis in the back. Spondylosis, you have spondylosis, that means you have arthritis, wear and tear in your back. Spondylolisthesis is the slippage, and spondylolysis is the fracture. I hope you understood this, and if you have questions, just let me know. Have a nice day.